Welcome back to movementprofessional.com. So this is the first episode of a series I'd like to do called It Hurts When I Do This. So basically I'm just going to look at common patient complaints over the years and try to break them down into understanding the intent or the mechanism of injury or pain, and then also some of the common categories of interventions that we might do to make it better. So we're going to start with having pain in the neck when rotating the neck, and the pain we're going to be talking about will be on the same side as the direction in which we're rotating to. So we're going to use the skeleton here just to get a little bit of a sense of anatomy. There's three basic categories of interventions I'm going to go over. So the first one's going to be at the joint level, and if we look at the anatomy of the cervical spine, we have the skull, and then right under the skull we have cervical level 1, and then we have 6 other vertebrae in the cervical spine, so cervical level 2, 3, 4, 5, 6, and 7. What we're really interested in here is where these joints connect. They're called facet joints. They're right on this side pillar right through here. So our goal of the first intervention is going to be to broadly try to create a little bit more space from one vertebrae to the next, so we can give the neck a little bit more motion wherever we feel restricted, so we can get more range of motion that's pain-free. All right, so if we're looking at the vertebrae here, the first type of intervention is going to be a mobilization with movement. So I'm thinking that I'm going to be putting my finger somewhere around the articular pillar here, or on one joint, and I'm going to be trying to create a motion or a stability of one joint while I move the other. So the first exercise I'll do, say I'm limited going to the left, is I'm going to take my right hand and I'm going to reach across the neck. So if I feel like I'm restricted in rotating lower down in the cervical spine, I'll start there and I'll put my middle finger on the area where I feel like there's the most pain, and then I'm going to try to create a motion that goes straight over to the right and a little bit up towards the ceiling. So I'm trying to create a little bit of a traction at that level, and then I'm going to try to create the rotation again and see if it makes it better. If it doesn't, or if it feels like a little bit better but I feel like I can make it better still, I might move it up or down, thinking I'm moving up or down this articular pillar here of vertebrae until I find the spot that feels best, and then I can move with the most range of motion with the least amount of pain. All right. If I feel like I found a spot that pretty much takes the pain away, I'm going to try to add some repetitions to that. So I might do 5 to 10 in the direction or with the finger in the position that feels like it's creating the most positive change. All right. And we can do that at any vertebrae depending on where we feel the restriction. You can also target specifically the upper cervical spine. So this cervical level 2 right up here, which is if we feel the vertebrae, it's where the bone, the spinous process sticks out the most. Oftentimes, even if the neck pain is felt a little bit lower down, I might target the upper cervical spine right in that region, just because so much of cervical rotation is controlled from that area there. So I may guide or assist the rotation from there and see if it actually helps me decrease a little bit of pain down lower. But that's just a broad categorization there of using my own hand to assist my motion or create a mobilization with movement. Another way to do that is to take what's called a Mulligan Strap, and it's named after Brian Mulligan, and a therapist from New Zealand, and he just came up with these techniques. So the strap you would use like your finger, except instead of having the finger as pinpoint, you would just put the strap on the level where you feel the pain. And if I'm going left, I'm going to take my left hand and pull it down and across. My right hand is going to go up and across, and it's going to create this motion where it goes up and over. And I'm trying to do the same thing, seeing if I can go a little bit farther with each repetition, and then assessing what level feels best, gives me the most pain, the least pain and the most range of motion. All right, so that would be one category of intervention. The other category of intervention would be to look for a few different muscles that I might be able to relax or inhibit, because oftentimes muscles will guard in response to pain, and then it gets in the way of the pain and it actually will make us be able to move with less range of motion and more pain. So if we can put some pressure on these muscles, a lot of times we can calm them down. We can also redirect the force. So oftentimes what we're looking for are muscles that will tend to pull the shoulder up towards the ear, basically close the space of the neck. If there's less space, there's less room for us to rotate in that direction. So the first area I'm going to look at is the upper trapezius. And you can look closely here, it's going to attach to the back of the skull, but also down into the the top of the shoulder blade here where it intersects with the collarbone. But where I'm thinking really is this point, this pinch point here, where I can get my finger right under and I can actually hold on to this upper trap. So what I want to do is I can use my other hand to help me reach across. I get this pinch point of the upper trap, and then I'm going to try to squeeze and pull down a little bit while I try to rotate. And I want to see if that helps me rotate with more range of motion and less pain. So if it does, I'll assess that for about 5 to 10 repetitions. Another area I can look at is the sternocleidomastoid, which again attaches to this back of the skull mastoid process, and then it wraps around to the front of the neck where we can pinch it right where it either attaches to the sternum or to the collarbone. So I'm going to get some of the meat of this muscle here, and I'm going to do the same thing here. I'll pinch and pull down and across at an angle that way, and then I'm going to try to rotate, and I can adjust my grip up or down the muscle to see where it makes my pain go away the most and increases my range of motion the most. I can do this on either side, so I can do it on the same side or I can do it on the opposite side. If I do it on the opposite side, what I'm looking to do is actually it'll limit my range of motion initially, but it can inhibit this side, which is actually if I rotate my head to the left, it's the opposite side muscle that's going to be involved in that rotation. So I can calm that muscle down to see if it allows me to have a little bit more range of motion going in that direction. So I could try both sides. We really are trying to do a little bit of a trial and error process using the symptom as information to see if it's making it better or making it worse, or if it's not having any change, then we have to move on to a different intervention. The other muscle I'll look at is right on top of the shoulder blade. So if we're looking at the skeleton again, here's the top of your shoulder blade, this angle here. There's a muscle called your levator scapula, which goes from here into the midpoint of the neck. So my idea here is I want to be putting pinpoint pressure down into that muscle to hold the shoulder down, again, to prevent that shoulder from riding up closer to the neck. So as I hold it down, I'm going to push down with my middle finger and then have my elbow heavy as I rotate the neck. And I want to see if that, again, helps the range of motion, decreases the pain. So then you have your joint-oriented interventions, mobilizations with movement, and then you have your muscle-oriented interventions, which would be a version of a massage with motion to try to inhibit the muscles that might get involved or might guard the motion of rotation. One last category of intervention would be to actually try to get rotation more throughout the whole body. So in an example where I'd be rotating the head to the left, I can think about just moving from the neck and the vertebrae of the neck, but I could share the load by creating a subtle rotation throughout the whole body. So the way I would do this is we're going to do interventions where we have the back against the wall and also back against the ground. But we want to think about if we're going to the left, that we're trying to create a shift, which would bring the left side of the upper back backwards, the left side of the pelvis backwards, and then that would create a little bit of a movement of the left side of the head backwards. So once we create that shift, so everything on the side that we're rotating toward moves back a little bit compared to the opposite side, we're actually assisting and opening the facet joints to allow for more rotation. And this can often be a game changer when we're trying to focus around the neck and nothing's really creating a change. It's often because we need to look down the change and appreciate the body as a whole. So the idea here would be we want this left side of the thoracic spine to shift back, the left side of the belt or left side of the sacrum and pelvis to move back, and then again that's going to create a little bit more rotation. So I'll show that against a wall and on the ground to get a sense of how we would do that as an intervention. So starting with the use of a wall, what we can do is we'll find the center of the back of the skull, the center of the back of my belt, and then the center of the area between the shoulder blades as much as possible so that we're feeling initially quite symmetrical on the wall. Because I'm facing the camera this way, we'll say that my right rotation is a little bit limited. So what I want to do in order to get this shift to aid that rotation is before I even move my head, I want to think about creating this feeling of pulling back through my right heel. So if I pull back through my right heel, that should create a sensation of the right side of the back of the belt being a little heavier into the wall. And then I want to feel like the space between my shoulder blades stays open. So I don't want to do any type of retraction or arching in the back. I want to feel that the spine stays in contact with the wall as much as possible. So I'll pull back through my right heel, and then I'm just going to feel like the upper back on the right gets a little heavier than the left. And I can really enhance that if I reach both arms forward and I reach the left a little more than the right, it steers me to the right. And then that should also make the right backside of my head get a little heavier than the left. Once I'm there and I feel like I'm holding that, then I'm going to add a little bit of rotation on the wall and just see if I can move. If this was initially painful without that shift, does it feel like I can rotate with less pain? If I can, I'll do 5 to 10 reps there. Some of the muscle references that I'm going to feel as I go to this side would be my right hamstring, because I'm trying to use the hamstring to pull the back of the belt to the wall. My right abs are going to help keep my back flat against the wall on this side. And then I'm going to just feel that as I rotate, that I'm going to feel sort of a broadness of the upper part of the back, and I'm going to be reaching with the left. So if I feel anything in the upper body, it would be the serratus anterior muscles or something under the armpit. Oftentimes that feels more of a stretch than an activation of the movement, but what I don't want to feel is any shrugging of the shoulders up through there. On this opposite side, I'm kind of feeling like I'm pushing my body to the right. So I might feel the inside of my foot on the left and maybe even my outer butt on the left, but most of the action is going to happen on this right side. And it would be the opposite if I was going left. If I was a little bit more limited to the left, I would think about pulling back through my left heel, so if I can feel my left hamstring. Inner thigh would also be involved, left abs. That gets everything heavier on the left. I would reach the right more than the left, and then I would try to rotate the head to the left. If we take that to the ground, we're going to do the same concept. Now the ground will act as the reference as opposed to the wall. So I'm going to tuck my pelvis, feel the back of the belt, touch the ground, feel the space between the shoulder blades in contact with the ground, and then the back of the head. And then this time I'll rotate right again. So I'm going to feel like I'm pulling back through my right heel. So that's going to get my right hamstring, right abs, reach my arms, reach the left a little more on the right. So now everything feels a little heavier on the right. Then I'll add the rotation, see how that works. I'm going to maintain all the other references. And then if it feels better, I'll try to go a little farther with each one and do about 5 to 10 reps through there. It would be the opposite on the left. Hopefully that makes sense. If you have any questions, you can go to movementprofessional.com. I'll see you next time.